Hi there. So, in this next lesson, we're going to hear from my primary care physician, my new primary care physician, Dr. Charlie Piermarini. One of his passion projects is CBD. He's written a book about it. He does CBD and cannabis coaching. And so I sat down with him and I interviewed him about what he has learned as someone who is both a medical practitioner and also someone who not only incorporates CBD into his clients and his patients' protocol, but he also does dry needling and a few other kinds of sort of Eastern medicine traditions. So he's someone who's combining multiple modalities to really work to help find what's best for the patient. And one of the things that I really appreciate about what he's saying here is for something like CBD and medical marijuana, because the field is relatively young and relatively new, it does take a bit of trial and error. But that's actually coinciding with what I've been learning about how I have reinvented my relationship to food. Because so he says it takes about 6 to 8 weeks generally, sometimes 4 weeks, for him to kind of coach a client along through the process of understanding what doses to use, whether to use CBD alone or a combination of CBD and THC, what their levels are, what their ideal levels are, and how they can actually notice in our bodies how our bodies feel after we treat it with something. And then he even talks about the idea that we sometimes develop a tolerance and how all you need to do is take a 2 or 3 day vacation from CBD or medical water, and then the body starts to kind of reset itself, which is very different from opioids. So I hope that for those of you who are dealing with chronic pain, that you will take this to heart and see if you can find a practitioner near you who's open to these kinds of treatments. So I hope you enjoy this conversation with Dr. Charlie Piermarini from the Healing Joint, and we'll leave some information at the end if you want to follow up with him and find out more information. I'm sure he would be happy to hear from you. Thanks. Beautiful. Okay. So why don't we start by having you tell me a little bit about why you are so passionate about CBD?
Okay. Been a physician assistant for 6 years now, 5 years in pain management, and just saw a lot of patients using it, and I didn't understand it until I did my own research, and just saw a lot of patients getting varied results with it. Some of them not curing themselves, but really alleviating a lot of their chronic pain issues. And so some patients getting really bad products, some patients getting good products. So started to take note, started doing a lot of research, and then I discovered that there's a whole endocannabinoid system within our body that no one ever teaches us about. So I just really wanted to take the reins and kind of lead this industry into the right direction and educate properly about what this molecule is, what the endocannabinoid system is, and how hemp and marijuana interact with our body. And then about a year and a half ago, I started my own company to really have control of the process of my products, and so we're here.
Yeah. Great. So when you say endocannabinoid system,
yeah.
I'm one of those people that has no idea what it is. So
okay.
Can you kind of spell that out for me?
Yeah, right. So the endocannabinoid, just endo means within.
Okay.
Cannabinoid refers to plant-like, molecules that refer to cannabis. So we have a whole system in our body that refers to receptors that bind to products that we use from cannabis plants. Hemp is cannabis, marijuana is cannabis. They're both cannabis products. And we also make 2, maybe up to 5, for sure 2 molecules that are carbon copies of CBD and THC in our body naturally.
Huh.
And they are, the endocannabinoid system is so important that it's found in every invertebrate and every mammal. And it is part of embryogenesis, which is basically when we're forming in the womb where organs need to be placed and how they're formed. The endocannabinoid system plays a role in making sure places are put into hearts up in the cardiovascular system, and everything's kind of running smoothly. So
we're primed for it, even
you
as
are
we're
primed
being
for it.
created.
Yeah. And one of the highest concentrations of endocannabinoids that the human body makes is in breast milk, and so using that as when the female gives to their kids, jumpstart the immune system and helps give them anti-inflammatory effects and brain health, and so it's very important.
Nice, nice. So what types of conditions are typically people who come to you who benefit from CBD?
So yeah, I mean, got to stay away from making claims just because CBD's technically not even a food drug or don't even know what it is.
Oh,
So
right. Okay,
yeah,
gotcha.
so what I see people using it for that can help is obviously pain, um, anxiety, sleep are kind of some of the big three that people use it that can help potentially help with some of their ailments. Always best to check with a medical professional to see if it has interactions with any of your medications that you currently take. But um, yeah, it's a natural product, and it's either isolated from the plant, or you can use a full spectrum product, and which has all the different plant products inside of it, or you can use just a CBD product with no THC. Or I mean, it's
Right,
very
right.
fast. Yeah.
So, for someone who may or may not be like me, I'm not admitting, but someone who may have been a recreational user even before it was legal to use
Yeah.
it for recreational purposes, can you describe a little bit about how a person might identify when it's just fun and when it's actually giving you health benefits?
Yeah, that's what the difficult and the good thing about cannabis is. It's very personalized.
Mm-hmm.
So, when I sit with patients and I coach them through how to properly use cannabis and CBD, it's a very personalized journey. It's very your endocannabinoid system responds differently to CBD than mine does. Your dose is going to be different. Your frequency is going to be different. Everyone's different. And so, a lot of people have experience when they were growing up as recreational users, but um, people don't realize that nowadays the stuff is made by PhD scientists, and it's a very different game than it was, in the 60s and 70s. A lot of my patients were using it,
Mm-hmm.
getting it from some guy in the back of the van, and, the typical stuff. But now it's, medical. There's PhDs, there's genetics, there's, we know a lot more. They're growing different strains for different types of cannabinoids, and so it's coming from the recreational side to the medicinal side. Sometimes people are, getting high is not usually what your intended purpose is when you're using cannabis. It's kind of to help with your medical conditions. And so coaching patients on, staying low, going slow, on how your titration is. Sometimes people were like, well, I just used to smoke it and get really high. Well, but that's not the medicinal part of this. It's different. So
Okay. So, do you, if a person wanted to sort of explore that, I know that not all doctors are really that into prescribing CBD or
yeah,
even medical marijuana.
yeah,
So, what would you suggest to someone who maybe they already have their regular primary care physician
Yeah.
who's not someone that wants to talk about it?
yeah.
How would you give advice to that person?
That's why I started my coaching business. So I try and, help patients across the state, across the country, coaching them on how to use cannabis and CBD properly. Um, Sometimes finding the cannabis physicians in your area that will recommend medical cannabis can be a good place to at least start. That's it's far and few between. It's very difficult. So
Yeah, and I have found that even from dispensary to dispensary, I have different effects. And, sometimes the CBD with THC will be fine and I'll feel, no euphoria, no high effects. And sometimes it'll be CBD alone or CBD with a low dose of THC, and then I'll suddenly feel like I'm a little high.
yeah, and that's the good thing and the bad thing about this plant is it's very, very hardy, and any changes in the environment from a slight elevation change in the field of where it's grown to how much sun it's getting versus its friend versus where the water's coming from. Even though the genetic line that was planted is confirmed, each plant will produce a different profile, even within the same field. So it's even though you may be getting whatever strain that you're getting at the dispensary, and you're like, oh, I know the strain. It depends on where they picked the bud from, or they're using the oil from, or what part. Because even the top part is different than the bottom part. So it's a very complex plant. So I wish I can give patients or clients hey, get this strain every time you're going to get it. But it's good and bad, right? It's a
Yeah.
trial and error. And it does suck when you find one that works for you, and then all of a sudden you're like, well, now it doesn't. The strain changed, or hey, they're not making this one anymore. That is a struggle.
Do you find that some clients or some patients, like if you use the same strain over and over again, do you find that it often no longer has an effect?
So yeah, tolerance can be an
Tolerance,
issue,
yeah.
but with the endocannabinoid system, the way it works and how it differs from opioid-like products is your body doesn't get addicted to the actual product of opioids when you get the dopamine, you get those byproducts of the opioid binding receptor. When you're when you're using exogenous cannabis products like CBD or cannabis, what your body does is starts just to downregulate receptors, not get you hooked on to the feeling that you're getting. So if you take a little short vacation, a little drug vacation for 3 to 5 days, receptors will reset, and you're going to be able to restart your dose at a lower dose and then go back up again.
So does it just take a few days to kind of reset that?
Yeah.
Okay.
Yeah.
That's good to know. Because I often find that, if I'm taking this on a daily basis, which during 2020, it was pretty much needed.
Yeah.
For both mental health and also my physical conditions.
Of course,
that I
yeah.
have. It ended up being a bit of a godsend, I would say.
Right. Oh yeah.
For sure. So if someone wanted to, because I know that when I have gotten my medical card, it's like a hit or miss whether I'm following the same doctor, which is what I appreciate about coming to you, because I know you're going to be my primary care physician. You
Right.
and I are going to follow my treatment.
Right.
So for someone who doesn't have, who should they go to guide them? Would you say just their medical card?
Yeah, I mean, it's a difficult situation. A lot of patients, a lot of states, if they do have medicinal use marijuana, it becomes a business. So a lot of the doctors will just charge you the cash fee plus whatever the state fee is to file your card.
Mm-hmm.
And they're really not counseling patients. And so then it's kind of left to you looking on the internet or asking a friend, so it's difficult. So that's why I created my cannabis coaching companies, to try and help patients get good use and proper use of it. And it's the field is just so new too. It's young. I mean, you got to think that we've only known about the endocannabinoid system since I think 1988.
So if someone comes to you and they want you to coach them on how to use this
Mm-hmm.
medically, how long, how many months would that process take for someone to kind of feel comfortable with what they're doing?
I would say within probably 6 to 8 weeks.
6 to 8
Sometimes 4 to 6. It all depends on the person.
Okay.
But I'm very conservative, and so I start very low, go very slow, and have people journal and talk to them about how they're experiencing, how do you feel, let's go down, let's go up, let's go down, let's see how you're feeling. But 4 to 6 to maybe 8 weeks is kind of when patients start to get, hey, I understand this a little bit better, I feel comfortable.
Mm-hmm.
Kind of they're able to fly the coop.
And how would you say the difference is in ingesting CBD versus using it topically?
So just a different route of application. Topically is very good for, if you have a arthritis or a pain somewhere on your elbow or your wrist or your hand or your shoulders or your back. You will absorb some of it systemically. So if there is THC in it, you could potentially be positive. Edibles, you get about anywhere from 20 to 30% absorption. So if you take, a 20 milligram, gummy, you get about 20 to 30% of that, about. The effects last much longer. Smoking it is the effects hit a lot quicker, about 60% of it absorbed, but it's a lot quicker onset and a lot quicker offset too.
Oh, right. Okay, makes sense.
So everything's a little bit different. Tinctures are probably where I stick most with. It's sublingual.
Mm-hmm.
There's a lot of veins underneath your tongue that will absorb the oil if you hold it there long enough. And that will be about a 30 to 40% absorption with about a 6 to 8 hour half-life. Ish. Everyone's different, but I mean, it's a very personalized journey. Everyone's dose is different. So
yeah. And even me, I find that I sometimes have to kind of just mix it up a little bit. And we have a friend who, he actually has the opposite effects to indica and sativa.
Yeah.
So he takes indica in the mornings and he's good to go, and then takes sativa to
which
go
is
to
totally
sleep
different,
at night.
right?
Right, for most people.
Well, do you know what the difference between any strain of cannabis is? You know what makes each strain different?
No, I don't.
Most people think it's the CBD and THC concentration. It's actually the terpene profiles.
Okay.
Is actually what differentiates. They're called cultivars, if you want to get specific about it.
Right.
About an indica or a sativa, that's a general class, and they have specific terpene profiles. One stimulating, right, with pinene, myrcene, so it's kind of a little bit more of a stimulating feeling. The indicas, kind of get you in that couch lock. They have a little bit more of the lavender. Eucalyptus type of scents that kind of just are calming, and it's all the terpene profiles. There are differing CBD and THC concentrations, but it's terpene profiles that differentiate between the strains.
And the terpene profiles, are those something that come naturally in the plant, or is that something people add?
No.
Oh, okay.
So some of my CBD products, we make a broad spectrum, so we use a CBD isolate with terpenes because I really want to make sure there's no THC in it. Some patients can't tolerate THC, some can't have it for their job. So, they're called the trichomes on the bud. You see the little, look like finger gelatinous projections. That is where all of the cannabinoids and the terpenes come from. And the plant naturally produces it for multiple reasons. One is for, like I said, the plant varies from the top to the bottom, and sometimes at the bottom, really exposed to bugs, right, that can sometimes eat and destroy the crop. So it makes terpenes that are pungent to those animals to kind of disperse them away from them. And then at the top, it makes really invigorating and inviting terpenes to get bees or something to come and pollinate it. So it's, like I said, it's very different from the top to the bottom of just even one plant.
Interesting.
Yeah.
Interesting. Okay. Anything else that you want to say to folks? Because just so you know, this project that I'm working on is a bit of a take charge of your own well-being kind of approach.
Yeah.
To know, like, what are my options that are out there and when should I... So for me personally, I find that it's very helpful for fibromyalgia, rheumatoid arthritis, anxiety, and depression.
Yep.
Are there any other types of conditions that you think it might be helpful for?
I mean, those are kind of the big ones.
Those are? Okay.
Yeah, low-hanging fruit. I would say you got to be your own best advocate, which you're very good at.
I had to learn.
Yeah, right.
Because I was like, I don't know, there's too many doctors and too many things I'm taking.
Right. And then a lot of my colleagues that are physicians just don't even care. I've offered to teach them. I have an online education course for lay people and for physicians to take. No one takes it.
What do you think it's going to take for the medical community to be more on board with this?
Everybody wants more published data.
Of course
it's the most studied plant in the history of the world. But they want double placebo blinded studies to show that it's safe. Well, there's already efficacy studies that show that it's efficacious and it's safe. Medical professionals are very good at algorithmic type of approach. If someone has high blood pressure, this is where we start, and this is where we titrate, and this is how we're going to add this other medication. Cannabis is exactly the opposite. It's kind of, you start kind of everyone here, and then where it goes is no one knows. So it kind of scares people. Plus, it's always had that whole connotation of being, devil's lettuce, and it's illegal, right? No one knows.
Or what did my dad used to call them? Funny cigarettes.
Funny, right. And so now making it into a medicinal, accepted medicinal purpose it's got a little bit of a way. It's getting better. My last talk in Austin, I spoke and I had 3 physicians and 1 nurse practitioner in the audience. And, they thanked me for kind of trying to be a pioneer, but that's far and few between. A lot of these physicians and nurse practitioners and PAs are they're scared. You don't want to put your head on the chopping block and all of a sudden, I lose my license or, so you have to be very, very cautious about what I say. I don't make any claims, it's check with your physician before you start this supplement.
And I think that that's a really good point that, again, I had to sort of learn for myself is checking with all of my physicians, checking with my entire medical care team, my whole, therapist, rheumatologist, blah, 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 blah. Because it is a lot. It's a lot to take in. And especially when someone's prescribing one thing and someone else is prescribing another. So I'm really happy that you have both the medical training and experience as well as this willingness to engage in, some of these other modalities.
Yeah, I mean, over 50% of my business is dry needling. They don't teach us that in PA school. I had to go learn that on my own. So, yeah.
Interesting.
Yeah, a non-opioid, non-steroid approach to help with, different types of muscle ailments.
Well, certainly. I mean, I think we can just look at the news any day of the week and see that the opioid crisis is very real and not going away anytime soon.
Oh, it's getting worse. Yeah. 160,000 people, I think, have died since 1989.
Wow.
If not more. I mean, that's just from prescription opioids. It doesn't count the people that start on prescriptions then move to, street opioids.
Right. Exactly.
I think it's closer to 400, they said.
Yeah.
It's almost 500,000 people.
Is there anything else that you really want people to know about CBD, medical marijuana, or even any of the other alternative, like dry needling or whatever else you offer?
You got to find someone that kind of is able, it's hard to blend, Eastern and Western medicine and different approaches together. I have the training with Western medicine, learning how to prescribe antibiotics and do all these certain things, but I think the body's just a very complex structure, and mind-body connection is becoming more apparent than, if anyone ever follows Dr. Mark Hyman, he's a functional medicine physician out of Cleveland Clinic. He's an MD, but he's probably one of the world leaders in functional medicine, which is looking at trying to root cause things, what's causing these issues. And he just posted today on social media that they think Alzheimer's is type 3 diabetes.
Interesting.
So it's all inflammation, carbohydrate intolerance, digestion, and so we're learning more and more, and the gut-brain connection is actually mediated through the endocannabinoid system, and so we're learning, there's more serotonin in your gut than there's in your brain, and it plays more into our overall health than we actually understand. We're getting better.
Yeah, I've been really fascinated by the things I'm learning with the shamans at the Four Winds Society as well, because he said, we already know that you can create psychosomatic illness. What we haven't accepted yet is that we can create psychosomatic wellness, is how he approaches it. And so this whole year for me has been all about the holistic mind, body, spirit wellness, because you can't have one without the others coming on board.
The integrative medicine has the eight wheel of wellness and happiness, right? It's
the 8 wheel of wellness and happiness.
There's 8 concepts, right? It's I don't remember them all, but it's psychological, financial, spiritual, social, mental, physical, right? It's not just one thing. It's what's your spirituality like? What's your it's not just how you we put a lot of emphasis on a healthy society as one without disease, but it's also more complex than just without disease. But what about if people are functioning with the disease, and how do we get them optimized? So
yeah, definitely.
Yeah.
I like the idea of social wellness too. I think that's important. And I think in the last year we've seen we need a lot of work in that area.
Well, we're social beings, and so putting people into isolation for extended periods of time, it causes a lot of issues. Yeah. People don't have coping skills either. People don't know how to meditate. People don't know how to cope healthy, right? People are abusing alcohol and opioids at record numbers, and because they're anxious.
Yeah.
But they don't realize, there's meditation practices, there's yoga, there's exercise, there's, it's okay to drink alcohol. I drink alcohol, but within moderation, and
sure.
So.
Yeah. Any other final messages for our folks? Okay.
Yeah.
Thank you so much.
You're welcome.
Charlie.
Thanks for having me.
Yeah.
Yeah.
No problem. Excellent.